They're coming in, Dr. Christina. I see him now.
All right.
This is one of the few live free events that MedCircle provides. And I'm so glad that you're able to join us. For those of you joining live, for those of you joining in the replay, you can access the links below this video for many of the resources and future classes and series that we discuss during this broadcast. If you are watching this on YouTube and you've not subscribed to our YouTube channel, please do so. We post new videos every week on mental health topics that matter to you, featuring specialists and doctors just like Dr. Christina Iglesia, who joins us for her second time on MedCircle. Dr. Christina, thank you for being here. And I know people are still going to be slowly rolling in as we approach the start of this. But as people come in, why don't you provide a introduction of who you are?
Perfect. So as Kyle said, my name is Dr. Christina Iglesia. I work out of the San Francisco Bay Area in private practice. I most likely work with people who come to see me around struggles relating to depression, anxiety, trauma, substance use, and different eating disorders. In addition to providing care in my private practice, I am also the founder of #TherapyIsCool, a mental health action campaign where we are raising funds to help make mental health services more accessible to people across the United States.
Incredible, certainly needed. And I'm so thrilled that you've taken that part or included that as part of your give back to the world. And another time, certainly, we need to talk about how MedCircle can help further that cause. If you are watching this live and would like to ask Dr. Christina a question on today's topic, which is trauma, post-traumatic stress disorder, and relationships, use the Q&A box at the bottom of your screen. Of course, we'll be communicating during chat, but questions will only be taken from the Q&A box. If you have any problems, just put them in the chat. Myself or Bridget will respond to you very quickly. Dr. Christina, when you see somebody who, or rather when you're treating somebody who's experiencing symptoms of post-traumatic stress disorder, and those symptoms are affecting their relationships, what are the common issues that you see?
So when I'm working with somebody who describes a history of traumatic events or a singular traumatic event, I am usually seeing themes around how this trauma influences their day-to-day life. And what I mean by that is after we've developed a trauma response, it tends to show up in our mind and body in different ways. Some of the more hallmark ways that we know somebody might be navigating trauma is hypervigilance, avoidance, depression, anxiety, fearfulness, suicidality, and a host of different struggles that we are able to pinpoint arise after a traumatic event has unfolded.
So we hear people say PTSD and trauma in the same sentence. Is there ever a time when PTSD and the word trauma could be used to describe the same thing? Or are these completely separate vocabulary words that have completely separate meanings?
I really appreciate that you asked that because there are different ways you can look at it. The way that I tend to hold the similarities and differences around trauma is that trauma is subjective in the sense that each of us can experience the same exact traumatic event and may or may not have a trauma response.
Right.
PTSD is objective. And what that means is there is a specific diagnostic criteria that us as clinicians follow to see if somebody is indeed exhibiting certain signs and symptoms related to their trauma. So while there's overlap, they are different. Trauma and PTSD while interchangeable in a lot of conversation, we have to remember that experiencing trauma in and of itself is not a mental health issue. It is actually the way that our body digests and responds that can turn into a debilitating and harmful experience where we then see the criteria being met for PTSD.
Excellent. My next question is going to be involved in the treating of post-traumatic stress disorder before we take member questions. But I do want to remind everybody that tomorrow we also have another free event. This is very rare. Typically, they don't occur back to back. There's lots of time in between. But tomorrow, Dr. Ish Major, another new doctor joining MedCircle, will be talking about the fear of intimacy, a highly requested topic. You can register for that event for free. It costs nothing, and you can attend tomorrow or watch the replay when you register. Go to medcircle.com/live or visit the links below this video. And Dr. Christina will be back on November 13th to talk more about PTSD, but more specifically, the impact it has with children. I imagine this is a must watch for parents and caregivers alike. That you will need to be a MedCircle member, and you can always start with a 7-day free trial so you can catch the class, explore the benefits before making any type of commitment. Dr. Christina, the types of treatments you typically use to treat PTSD are?
So there are, thankfully, and when I say thankfully, there are several that are out there, because I truly believe that having as many options as we can for treatment is absolutely important. That way, if one specific type of intervention doesn't help relieve, there are other options. So when we are treating PTSD, we tend to think about trauma-informed care. And that means working through the lens of identifying what the traumatic symptoms are that are coming up and the ways that trauma has then impacted the person's life. We can do that through EMDR, talk therapy, body work, somatic experiencing. So there are these different branches of treatment interventions that are available so that people can go and seek out support and hopefully are able to identify one that allows them to safely process the traumatic events and be able to kind of integrate and move forward from that trauma.
Excellent. Well, of course, MedCircle has series on all of the treatments that Dr. Christina just explained. I'm sure we'll go into more specifics as this live event continues on. Let's get into some questions from our MedCircle members. This person asks, can you can you ask about complex post-traumatic stress disorder from childhood emotional neglect from a narcissistic mother? Dr. Christina.
Wow, that is a lot. So when we hear the word complex PTSD, we are thinking about this ongoing traumatic experience. So that can be either a trauma that we experience, for example, this question with a caregiver that is ongoing, but it can also mean different traumas that have accrued throughout our lifespan. So when you hear the word complex, you're thinking of multiple, and you're thinking about ongoing traumatic experiences that somebody has then in turn been subjected to. When it comes to early childhood, we absolutely want to pay attention to any kind of abuse, neglect, around basic needs, but also emotional needs. Childhood is where we are forming our earliest of attachments. And if those attachments are strained, non-existent, or unreliable, then we from a very early age are unable to navigate our own internal experiences in a healthy way. So it can absolutely happen with caregivers. It can happen with other people throughout our lifespan. But the idea that our parent or parents are unable to meet our emotional needs, absolutely can set us up for a lifelong struggle around traumatic experiences that, unless we're able to acknowledge, identify, and then seek support, can be carried with us ongoing and actually to the generations that follow.
So what is the difference between PTSD and complex PTSD?
So complex PTSD is not technically in the DSM, which is our diagnostic manual, but it is well regarded in the mental health world as, again, not necessarily one specific traumatic event, but multiple or ongoing layered traumas that tend to build up in our systems and ultimately lead us to having emotional or mental distress. PTSD is a very specific subset of symptoms and signs that we are vulnerable to develop after a traumatic experience. Complex trauma has much more wiggle room for what that trauma looks like and how it can be journeyed through our lifespan in different ways that maybe even isn't as apparent to the outside viewer or even the person that's experiencing it themselves.
Yeah, I mean, my layman term or my layman explanation of this, so correct me if I'm wrong here, is that a lot of it has to do with the cause that led up to the diagnosis of PTSD or the pseudo diagnosis of CPTSD, where if I was in a traumatic car accident and it was just terrible, and it was the worst day, and I could develop PTSD from that one event. But if I was in a relationship for 15 years with a narcissistic spouse, and every day it was just this constant beat down emotionally, that 10 years could develop into complex post-traumatic stress disorder rather than the PTSD by itself diagnosis.
Yeah, I think you explained it beautifully. This idea that, again, it's ongoing and it doesn't have to be just one experience or even an experience with one person. It can be this myriad of different experiences, some small, some medium, some large, that ultimately become so distressing to our system that it impacts our ability to function and take care of our own needs, whether that's school, work, relationships. It absolutely can get to a point where we become debilitated by these traumatic experiences.
Well, if you're just listening to us, head on over to your device and check out the screen. Our senior producer, Bridget, has a poll for all of you to answer. This will help navigate some of our discussion here. Question is, what type of relationship are you here to learn about? The relationship with your partner, your parent, your adult child, your young child, or something else? Your results are anonymous. We'll never know who said what. I'm going to even choose one too. I'm going to choose this one. Perfect. Oh no, I can't vote. Sorry. Okay. Well, when we have those results, we'll get those up there. In the meantime, let's go to another question. Dr. Christina, this MedCircle member says, hello, Dr. Iglesia and Kyle. Hello. I suffer from CPTSD. I have been going to therapy to try to address my anxiety and depression. Good for you. I was wondering how I could address my hyper awareness. Dr. Christina.
First, congratulations for seeking out the support that you absolutely and truly deserve. I think that so many of us are unable to get to that point for many reasons. And so the fact that you've already started your journey lets me know that the prognosis is good because you are in hopefully a safe, supportive, therapeutic alliance where you can start to address these specific things around arousal. When we think of arousal, we are thinking about the fact that our body is in constant high alert. When we survive a traumatic event or events, our body becomes rewired to be always on edge in hopes to protect us. What we don't realize is that some of these symptoms are actually there to serve us, but our mind and our body doesn't realize that the traumatic event has passed And so we are navigating the world at this hypervigilant, overly aroused state where everything can quickly become overwhelming and can exacerbate any other mental health symptoms that might be there, whether it's anxiety, depression, and truly impact our ability to function. So if we're thinking about the ways we can navigate hyperarousal, my hope is that people are able to find professional support where they can start to talk about the things that initiate that physical response. The other thing that we would want to pair that with is there's a lot of body work that can be done so that our body can relearn that we are actually safe, that we don't need to be in this hypervigilant state. And so body work, somatic therapy, EMDR, all of these are there to help not only how we're cognitively holding the traumatic event, but how that energy is stored in our body in a hope that we can release it and not be operating at that level consistently.
We've mentioned EMDR a few times. Can you give a description of what that is?
So EMDR is a very specialized trauma-focused therapy where a clinician or mental health provider would have to go under a certification process to be an EMDR practitioner. So if you're out in your community, look for that. You need to be looking specifically to a mental health professional that can provide it. EMDR is the work that we can do with a certified EMDR specialist around reprocessing our trauma in a safe and contained way through a desensitization process that often revolves around tapping and physical work to help us reintegrate the way our body and mind holds this trauma. It is absolutely one of the gold standards around trauma treatment and is usually in the top of my list of recommendations if I have somebody asking me what kind of treatment will help me not only be able to process this, but to truly find safety in my body again.
Excellent. EMDR, you mentioned the need for someone who's actually been trained and licensed, or whatever the correct term is in that. And I thank you for saying it, because y'all, if you go to a lot of these therapist websites, they treat everything and they just do it all. And what I've learned from talking to all our MedCircle doctors is that that's rarely the case. Truly, people tend to find specialties. So if you're looking for a provider and they treat it all, children, adults, OCD, eating disorders, they do it all, they might not. Okay, so just research your provider, interview them. Very good stuff. We do have the results of the poll. Bridget, why don't you throw those up on the screen? Looks like number one, relationship with their partner. Very good. Now, do these results surprise you at all, Dr. Christina, or is this in line with what you see in your private practice?
Absolutely. I think that if we ourselves have individually experienced a traumatic event, or we're in a relationship with somebody who's experienced a traumatic event or ongoing trauma, it absolutely impacts that dynamic. And to try to separate it would be nearly impossible, because the trauma is stored within us or that person. And so therefore the lens and the way that we navigate life is tinted because of those things. And so the goal in so many of our relationships is finding partners and people and friendships that are safe for us to hopefully have what I call these connective and emotional corrective experiences.
I like that. I noticed that the second most popular vote was other. And if you were one of those other people and you feel comfortable sharing with myself, I would love to know. You can just put an anonymous question and you can just say why. I'll see it. I won't know who you are. It really helps us create content that you, a MedCircle member or future MedCircle member, wants to see from us. So thank you for that. Let's go to our next question. And by the way, none of this is happening on YouTube. So if you're on YouTube going, I don't see the poll, and what is he talking about? It's all happening on Zoom. You need to register. You can go to medcircle.com and register for our next class. This person says they are struggling with childhood trauma and intimate relationships. Mm-hmm. I want to know how they should overcome this. How can they overcome this?
Again, it's such an important question. And the fact that this person is able to acknowledge that there has been pain that is impacting them is the first step. I always tell people, if we're not aware or we can acknowledge that we've been through something traumatic, then we can't heal it. And so if somebody is able to identify that they have struggled with something in childhood and are interested or willing to do the work to navigate that healing journey, then they're off to a great start. I always believe that having professional support is key. And the reason I say that is because we can have the best support system, great friends, great family, great relationships, yet they will be biased because they're part of our lives. And they will potentially have a hard time separating what might be useful and healing and find themselves more creating a space on how they think you should navigate, how they think you should heal from it. And so I do believe that seeking professional support is absolutely the start of where somebody can truly have a safe space to unpack, process, and ultimately heal things that deserve to finally be free from.
Excellent. Well said. We'll go to our next question. This MedCircle member says, how long does it take to overcome betrayal trauma when the partner is only halfway committed to understanding the trauma and symptoms that come along with betrayal trauma? Any help is greatly appreciated.
Betrayal trauma. So I am connecting the dots and thinking that this person, and please, if you're able to correct us, is saying that a betrayal occurred that then in turn was traumatic. Kyle, is that kind of how you're holding that question?
That's how I understand it. And maybe just for the sake, because we can all benefit from this, certainly if the partner you're in a relationship with has betrayed you, that can be traumatic and present its own set of issues. But a lot of people were betrayed in a past relationship.
Totally.
Those issues are bringing them on, I'm guilty of this, to their current relationship. And so I think if we address both of those, it would be beneficial.
Absolutely. So I think that we absolutely can be hurt, harmed, and traumatized by our interpersonal relationships, whether it's family, friends, and romantic, which is what we're talking about. When we've experienced a betrayal, we are often left with much more questions than answers, much more pain than love, right? And so we find ourselves trying to figure out how to navigate it. And this question was asking about a timeline. How long does it take? And as much as I would love to give you a set date and time where you will feel differently, it is truly about where you and this person can join together and hopefully do the work that would be needed to repair. So if it is a current relationship, I tend to think about couples therapy, right? As a mental health professional, I think about the different ways my field can support people, and couples therapy is one of the first places people go when there's been a fracture in a relationship, right? A betrayal. I also think about if we're holding on to previous betrayal in relationships that maybe we're not in, figuring out how we can process that, whether that's seeking support, whether that's journaling, mindfulness, a whole list of options where we are actually taking inventory on how this pain is showing up for us and finding healthier ways for us to navigate it so that it doesn't bleed over into the relationships that we hope to have moving forward.
Understood. I had a question about that, but it just skipped my mind. This happens every now and then. If it comes back, I'll ask it. But thank you for the question and answer. This person says, do you have experience with patients dealing with post-traumatic stress disorder following a psychological episode? If so, are there ways to help?
So again, me trying to formulate what I think this question is asking. If we're talking about our own psychological issue, or if we're talking about somebody else's psychological issue, right? Because if we ourselves, let's say, had something like postpartum depression, right? It has an onset, all of a sudden we're experiencing really significant and debilitating depressive symptoms, that in turn can feel traumatizing because we had yet to experience something in that nature and therefore are trying to navigate this onset of depressive symptoms without help or support or even knowledge that this exists. If we're talking about somebody else in our life who might have a psychological issue or concern, as an observer, that can be traumatizing as well. Because when we see somebody who we care about or love that is struggling and we feel unable or unequipped to support them, we can often feel hopeless, helpless, and without answer.
So in this space, you're dealing with a patient who is living with PTSD after this psychological episode. What would you do as a doctor?
Yeah, I would invite that person to use this space to figure out where to start around that. I think that a lot of times there's misconceptions about what trauma work is or isn't supposed to look like. Mm-hmm. And us as therapists have to meet the people we work with where they're at. So if somebody's coming into my office and they're not able to talk about it and they're not able to start to process and digest, then my role is to start creating a safe container for them to do that. Mm-hmm. Sometimes people are ready and are aware and are able to start to do the inner work to invite discussion and processing and understanding and feedback around the events that were traumatizing. Mm-hmm. At that point, I would meet them where they were at and be a safe container as someone starts to navigate what they're needing in order to process the trauma. Trauma therapy is not a one-size-fits-all in the sense that the work one person does to navigate trauma isn't necessarily going to be the same work that somebody else does. There's different timelines, there's different interventions, and there's different ways to feel supported. And so having somebody show up in my office, it would be important for me to have an open conversation about where they were at so that I know where they need to go.
Really excellent. I've been in therapy since I was 9 years old. I've never had a therapist push me too much. And I've been very thankful about that. Yes. Because especially if you're coming in with trauma, you might need weeks or months just to feel comfortable in the space with this new doctor, let alone to talk about the very worst thing that's ever happened to you. So I love, make sure you listening, if you're a patient or a supporter, that you're empowered to feel comfortable in that space. A little bit of pushing, I think, at some point can be healthy, but it doesn't have to occur within the first 10 minutes of your first session with this brand new person. As a reminder, MedCircle is not a treatment service and does not aim to replace or replicate treatment in any way. MedCircle and MedCircle Live classes are for educational purposes only. Dr. Christina, do you have experience? I've already asked you that question. So
Next.
Dr. Christina, is the treatment for complex PTSD and PTSD the same? Specifically, this person is saying CPT, but perhaps they mean CBT, as in cognitive behavioral therapy. Does that therapy work for both?
So CBT is a form of talk therapy, right? Which we actually hold differently as some of the other therapies like EMDR, somatic experiencing, body work. So CBT can be useful if it is more specified, like trauma-focused CBT, which is a very specific type of CBT. We don't necessarily find a whole lot of success in just pure CBT when it comes to trauma, because trauma tends to be held not solely in our cognitions and behaviors, which is what CBT stands for, cognitive behavioral therapy. We know now through research and trials that trauma therapy is much more specified to treating all of the aspects and complexities that go with it. So understanding that complex trauma, regular trauma, PTSD will likely have something that is trauma focused versus one of the more broad and generalized treatment approaches, such as psychoanalytic, CBD, right? DBT, ACT, all of those can be incorporated, but probably aren't going to be the standalone treatment for trauma.
If you think that CBT or trauma-informed CBT would be right for you, we do have a series on that. Bridget will put that in the chat box right now as we are live. Dr. Christina, this person says, thanks for this great information. How can I heal from CPTSD when the perpetrator is still in my life? Great question.
First, it's just important to acknowledge that's hard. It is hard. And I think of the word boundaries. And I know boundaries is kind of this hot topic right now in the world. But when I think about boundaries, I think about how are we positioning ourselves to have an appropriate level of distance from somebody that may still be in our lives. I think about a parent in a child relationship that when we are older and we become adults, we do have to decide, how can I heal while deciding if I want to continue or discontinue a relationship that's been harmful. Some people will choose to discontinue, but a lot of people do continue these relationships because they are under a framework of family or obligation or some kind of tie that is more difficult to break from. So I think about boundaries, and I think about asking ourselves, how can I show up in these relationships where I am still taking care of myself and my healing journey first? And that might feel uncomfortable, and that might feel selfish, and people might not respond well to your boundaries. But at the end of the day, your healing journey and your healing work has to be the most important part so that it can be successful and ongoing for you.
Excellent. This person says, can dietary changes help PTSD and strengthen brain function?
I like this question a lot because it talks to all the ways that we can empower ourselves in the treatment of PTSD. And what we know is that PTSD impacts our mental health, but also our physical health. And so when we are thinking about the ways that PTSD shows up, it absolutely shows up in our energy levels, in our sleep patterns, in the way we make food choices, right? So if we are trying to figure out how can I take care of myself in a holistic way, right? Mind, body, then dietary changes can absolutely be fruitful for people who can then in turn feel empowered to figure out the small shifts they can do in their own lives, in their own time, outside of professional support, where they can see a benefit.
Yeah. Is there actual dietary evidence or evidence on specific diets? Like, I don't know, high protein, I'm making stuff up.
While I don't know things like high protein or specific diets, I do know that we want to be checking in with how we're fueling our body in a way that doesn't allow for big spikes or big lows. And what I mean by that is if we're drinking too much caffeine, if we're eating too much sugar, you're going to notice that your energy levels are spiking and dipping, spiking and dipping. Same with alcohol consumption. You're going to notice that you have a baseline and then you're going under, and a baseline and going under. So knowing that part of our healing journey is learning how to regulate our mood and our affect and our energy, then we should be thinking about all the things that impact that, whether it's exercise, finding joyful movement, sleep, meditation. These things should be part of what I call our toolkit so that we are active participants in all parts of our healing journey.
Excellent. This MedCircle member asks or says that they want to give a shout out to their American brothers and sisters. Got a little question. Thoughts on the way PTSD is portrayed in movies and TV generally, and if there are some good key examples you guys have been moved or affected by.
I tend to think about media portrayal of mental health struggles as sometimes being on point, but mostly not. And I think that it's because in order for people to understand mental health struggles, media tends to exaggerate what they might look like so that people can try to develop an understanding of what that is. And so when I see PTSD displayed in movies, I think sometimes they are able to show little snippets of what a flashback might look like, or what, distressing and intrusive thoughts might look like. But we have to always remember that PTSD in movies is not going to be the way that it's experienced in ourselves. And so we shouldn't use that as the diagnostic criteria of if we are or not experiencing it, because each of us may show signs and symptoms that are completely different and invisible, where movies wouldn't be able, TV shows wouldn't be able to really capture the essence of it.
Sure. I do agree with everything you said. And I have found, though, that it seems to be getting a little better. Like they're holding themselves accountable to tell at least something that is likely, rather than something that is so off the wall you just wouldn't see it. And I learned about a month or so ago that we have a small subset of MedCircle members who are writers and actors, and they only have a MedCircle membership to prepare for a role or to prepare for a script that they're writing that involves some mental health thing. And so I thought that was a nice little tidbit, a little fact. This person asked, how does dissociation affect trauma work?
Oh man, that could be a mini novel, but absolutely. So dissociation is the experience or experiences where our mind actually tries to protect us from the intensity of the trauma, where we will either dissociate, detach, depersonalize while the trauma is happening, and or continue to do so when certain triggers are activating things that remind us of the trauma. The goal of trauma work around dissociating is learning the tools and techniques to navigate the things that elicit dissociation, and actually grounding ourselves in those moments where everything in our body and mind wants to dissociate, and learning how to sit with uncomfortable thoughts, feelings, experiences, so that we can retrain our body not to check out, but actually to be present and allow ourselves to know that we can be safe in the moment. And that is a game changer for trauma treatment.
And how do you know if somebody is dissociating, regardless if they're in treatment or not? You're just having a conversation with them.
So if somebody is sitting across from me, let's say, and they are in the room with me, I might pick up certain signs around dissociation if I notice that they're unable to track our conversation, right? So they might look distracted, checked out, daydreaming, or if I'm asking them potentially a question or them saying something back to me that is not in line with what we were talking about. So if I said something around, oh, and how did that make you feel? And the person might say like, oh, sorry, I wasn't paying attention, or, oh, sorry, can you repeat that? Dissociation can often not look like what media portrays, right, as we were talking about, but much more not being in tuned in the present moment and checking for signs that maybe somebody isn't actually available just because they're physically there.
Understood. This person says, can you talk about having two narcissistic parents while also being adopted and being an only child? They said, yes, I have all three. Help.
It's a lot. It's a lot. And one of the most difficult experiences people can have is with their caregivers. I truly believe that so much of our traumas can stem from our early childhood experiences. And it sounds like for this person, there were multiple ruptures in their cognitive and emotional and mental development. Everything from adoption, which can be extremely traumatizing for people, to then having a different caregiver, which again disrupts that attachment, to having parents that are unable or unwilling to connect with us in an emotionally safe space. My hope, per usual, is that this person has access to mental health support, because you are absolutely deserving of having a space for healing and processing and navigating those experiences that influenced and shaped who you are and who you want to be.
If you have struggled with a narcissistic parent in your life, or if you are struggling with any type of narcissistic relationship, MedCircle has so many series on the topic. We've hit it from almost every side you can hit this topic from. And what I have found with mental health education in general, but especially with narcissism, is that the understanding of it takes away some of the guilt you may not even be realizing you're feeling, some of the embarrassment, the frustration, because now you're educated on what's going on rather than getting blindsided by all of these really aversive experiences. Tomorrow on our blog, I just finished reviewing it. We have an article going out on different examples of narcissistic abuse. Some people don't even realize the abusive situation they're in until they get that education. So do not feel as though because these people in your life have such strong roles, like parents or a boss or something, that you do not have control. You have control of yourself. You have control of what you understand and what you get educated on. And we can help you get educated on that topic even more. I love this next question because I have the same question. What are your thoughts on brain spotting? And what is that? I don't even know what that is. I had been doing brain spotting with my therapist prior to COVID, but unable to do it virtually. I still don't understand how it works like I understand EMDR. Dr. Christina.
Yeah, so brain spotting is one of the more recent developments for trauma treatment. And while I am not an expert on what that is or what that looks like, because it's not in my wheelhouse, what I am hearing from people who are participating in it is that it is a different way for us to process traumatic experiences with, again, a practitioner who has a special training, again, a certification in brain spotting. It is one of the newer developments in the trauma treatment world. And like I said earlier, I'm very happy that we continue to try to find different ways to support people. The problem with COVID is that a lot of the work does need to happen in person, similar to EMDR. And so when we are not able to meet with our therapist, some of these more productive treatment options aren't available and can make us feel stuck or set in the progress that we're experiencing.
Mm-hmm. And so what are type of treatments for trauma that you think would have a good efficacy in a virtual type of setting?
Mm-hmm.
Like, can we do EMDR like this?
I tend to not think that it would be ideal on a trauma treatment level. I do think that there's other ways that talk therapy and a trauma-focused and trauma-informed therapist could navigate it. But if we're looking for specifically something like brain spotting, right, where it has to do with our mind and our visuals and EMDR, then we do need to have that in-person experience to help walk us through that. While there might be therapists out there that are able to do it electronically or through telehealth, it is something that has to be discussed prior to trying to navigate it on an online platform so that people are aware of the potential limitations that could happen when they aren't able to see their practitioner or therapist in person.
Understood. At the end of this live event, I'm going to stay on for anybody who is not a MedCircle member and would like to learn about the different offerings MedCircle has. It will take about 2 minutes. I'm going to try to even do it faster than that. So please stick around if you're interested in learning more about how you could benefit from a MedCircle membership. This person says, I'm currently in therapy and my therapist is not sure if it's BPD, BPD, or complex PTSD, as there is so much overlap. Is it possible to have all three? My therapist believes that they really may all be the same thing, but it makes it very difficult to diagnose.
Kyle, can you repeat what the second one was? I heard BPD.
So I believe it's borderline personality disorder, dependent personality disorder, and complex post-traumatic stress disorder. And she's wondering if it's even, or this person is wondering if it's even possible to have all three.
It is, that one's such a hard one because I think it absolutely would need more information before any of us could say that that is or isn't possible. I think that when we experience trauma, it absolutely sets up for some of these traits and characteristics to develop. And what I mean by that is that a lot of professionals, such as myself, view BPD, borderline personality disorder, as a characteristic or a trait set that happens due to trauma. So because a traumatic experience or experiences has happened, that sets a foundation for maybe some of these not so useful personality traits or experiences to then come. While it can absolutely be relieving for us to understand diagnostic labels, for me, the most important person is the person that's experiencing it and how they want to hold that information. How do you want to see the things you're struggling with? Because I think that a diagnosis, again, can be helpful, but at the end of the day, if we're able to hone in on specific traits, personalities, attachments, behaviors that aren't serving you, then we can do the work irregardless of the name that we put on it.
Y'all, that was the big takeaway right there. That means so much, because look, if your life is suffering because of emotional regulation or your inability to do that, okay, well, call it whatever you want. You're suffering over here, and we want to find solutions that solve some of that suffering. So I understand why it's important, but I'm just so glad you said, look, that is important, but at the end of the day, this is about you and how you want your life to look and how I can possibly help you. Let's get to another question. This person asks, what are some examples you can give of sexual abuse or trauma that's not physical violence?
Mm-hmm.
Okay.
Mm-hmm. Yeah, I think that, again, us trying to think about sexual abuse, we automatically, just due to how we're taught, think about a physical violent event. Yet sexual abuse can be anything from actual physical violence to harassment to insinuation, right? So if you have somebody in your life who is sexually harassing you, that's abuse. If you have somebody who might not be performing a specific violent act, but is absolutely making you feel objectified, sexualized, or unsafe, that is sexual abuse. So it's important for us to broaden the takeaway of what actually sexual abuse is, because of course there is the violent aspect of physical contact, but a reminder that there are other ways that it shows up that can impact us in a varying degree.
Excellent. I'm going to leave it with this question, Dr. Christina. Can trauma and PTSD mimic other mental health issues?
Yes, absolutely. It can absolutely influence most of them. And what I mean by that is I've had people come in saying that they're struggling with, let's say, ADD. And it turns out that because of the traumatic events they've navigated, that's short-circuited their attention or ability to focus. And once they've healed from that, the ADD-like symptoms are no longer prominent.
Mm-hmm.
Similar with depression, anxiety, we think about a lot of these mental health struggles as being individual, but I always welcome the conversation of, is there any trauma in this person's life that might actually be manifesting these symptoms? Yeah. That if they had the support and the tools and the techniques to navigate it, they wouldn't have these struggles.
Mm-hmm.
And so we need to be checking in with ourselves and the people in our lives. And one of the beautiful parts of being a trauma-informed therapist is that we're always having the door open to see if trauma has taken place, whether directly or even indirectly. And what I mean by that is generational trauma, systemic trauma, right? All these things impact us. And if we can be aware of it and we can have understanding and education, then we can actually move through so much of our own mental health struggles and find resolution, because trauma shows up in all of these ways that many of us have never known or been taught about.
Wonderful. Dr. Christina, I'm so glad you're here sharing your insight and knowledge with all of our MedCircle members. We'll be back on November 13th with Dr. Christina to talk about PTSD in children. If you're not a parent or caregiver, send medcircle.com to somebody that you know who is so that they can register for that very important live class. That will actually be 90 minutes long, so even more time to get your questions answered. Thanks for being here. Don't leave yet if you're not a MedCircle member. I'm going to show you in 2 minutes the benefits. But for now, I am Kyle Kittleson. And remember, whatever you're going through, you got this. Thanks, Dr. Christina.
No problem.
You're welcome to stay. Otherwise, I know you're busy, and we'll see you soon in 4 days.
All right. See you guys soon. Bye. Thank you.
So Bridget, if you could give me the ability to share my screen, that would be great. And I will show everybody who is going to stay and watch, and no pressure. If you want to be here, great. If you don't, all good too. So hopefully now you can see my screen and my messy dashboard. Here we go. So MedCircle.com is where you should start if you are not a MedCircle member. The reason I say that is because you can choose one of these personas, so to speak, and get a more custom journey on the benefits and value of a MedCircle membership. But just for time's sake, I'm going to show you our 2 biggest benefits, or 3 rather. First, at watch.medcircle.com, you can see our entire video library. It's very extensive. Past classes, like the one you just watched now, are uploaded here within 72 hours. And when you become a member, you get access to all of our past classes. This is something we just released a few months ago, and it's been met with much well wishes, I guess, from our members. They really like it. You can search here, access free series here. We have them labeled by category and by doctor. So this is our whole video library, and it's the only mental health streaming service that I'm aware of. So it is a great resource for you to have, regardless if you're here for yourself, for somebody else, professionally or otherwise. After that, our MedCircle live classes are typically for MedCircle members only. You see that today we have one, we just had one with Dr. Christina. Tomorrow we have one with a brand new doctor, Dr. Ish. You can register for that one as well at no cost. From there on, they are members only, but all MedCircle memberships start with a 7-day free trial. So if you cancel within those 7 days, you're good to go. You won't get charged a thing, but hopefully we do a good enough job showing you the value of a MedCircle membership. Let's see here. Our MedCircle app was the #1 request at the start of the year. So we released that this summer, and something's wrong with my computer, but that's okay. It's on Android and iOS. You can access all of our video series there. You can download them for later work use. You can customize that experience as well. So it's really a fantastic app that I'm very proud of. If you have any questions about a MedCircle membership, or if you think that you might be eligible for a discount on a membership, that's for students, teachers, professionals, members of the military. I think there's more. If you think you qualify, just send me an email, kyle@medcircle.com, and I will make sure that we get you started with the best membership for you. And I just got to show her because, she's whining because it's dinner time. This is Callie. Yes. Yeah, and now she's quiet. But Callie makes appearances in a lot of the videos. So hopefully you like animals because Callie's in a lot of those videos. If you have any questions, kyle@medcircle.com. Thanks for being here.